Hello. I'm Jennifer Hamme. I'm the Director of Early Childhood Development and Trauma-Informed Care at Children's Hospital of Wisconsin Community Services. And I'm here today to talk with you a little bit about creating safe and supportive environments for both clients and staff. Just a little bit of background on me. I have worked with for Children's Hospital for about 21 years in a variety of roles. The most recent, prior to this one, of running the Child Abuse Prevention Fund, which allocated grants and contracts to community-based organizations that were not part of Children's to do prevention programming around child abuse and neglect. This role that I'm in now is a brand new role to the system as of the last almost 2 years. And we are really focused on creating a trauma-informed care culture shift at Children's throughout all of our service delivery areas. So on our medical health services side, as well as our community services side, which does a variety of programming from child abuse and neglect prevention, intervention, treatment services, community health and education services, violence, community violence prevention work, school nursing. It kind of runs the gamut. So I'm going to talk with you today about creating the safe and supportive environment for clients and staff. Understand that we've just sort of started our journey, and so I'm going to be interlaying a few examples of what we've already done, a little bit about what we plan to do, so I'm hoping that you'll be able to learn a little bit from that. Let's lay the groundwork a little bit for the context of what I'm going to share with you. In my role as a Child Abuse Prevention Fund Director, I was part of a state-level adverse childhood experiences and trauma-informed care work group. And one of the things, the deliverables that this work group produced was two of the documents that you have as handouts: the Creating Trauma-Informed and Developmentally Appropriate Systems of Care in Child Abuse and Neglect Prevention, and then the companion document, which is the assessment tool that will allow organizations to do some self-assessment. And just to kind of orient you to those two documents, the first one, in terms of the guiding principles, really is based on work that's been done in both the trauma field, but also the homeless field. And it really outlines all of the guiding principles from a minimal context. So these would be sort of the minimal kinds of guiding principles that we would encourage organizations to follow. And if you run to the third page on that document, you'll see that they're organized by categories of principles. So there's several principles, but then underneath that by the staff. So what we might expect from direct service staff, what we might expect from supervisors, managers, and agency leaders. And we did that intentionally because as we were having our discussions, it was pretty clear to us that there would be different expectations given the different roles in the organization. And then at the back of that document, page 9, you will see that there is a crosswalk in the back, because if you looked at the second document, which is the self-assessment, it is not organized the same way that this one is organized. And so what we did was we created a crosswalk, because many of the assessment questions will cross over into varying guiding principles. So if you, as your organization, or you share this with someone else, they'll need to take a look at both of the documents side by side in companion. And then part of the outcrop of this work at the state level was because of the work that the surveys that were being done around adverse childhood experiences in Wisconsin, which started in 2010. And we had, Children's Hospital was a co-sponsor with multiple state departments, as well as the Child Abuse and Neglect Prevention Board, in both paying for the surveys to be done, all of the data analysis, and then the subsequent reports. I did not bring those reports today. They are available on the Child Abuse and Neglect Prevention Board's website if you wanted to have access to those. I'm going to get into the principles and organization of the self-assessment, specifically the second part where it talks about safe and supportive environments. I'm not going to go through the entire tool because we don't have enough time today. And then I'm going to be interweaving as I mentioned, some of our experience at Children's Hospital of Wisconsin. So it's important for us to think about and talk about the lens of trauma theory with which at least Children's is looking at this work. And I want to read something to you, that the definition that, our working definition that we're using, and that it is understanding that what happens to individuals when they are hurt is really individualized. So that trauma, any trauma event or any event that happens may or may not be traumatic to a given individual. It is entirely dependent on their prior experience, their ability to cope and be resilient. And so when an event happens, a car accident, someone may react to that car accident differently than someone else. So I think about the experience in my personal life with my teenage son when he had his first fender bender. And at a very slow speed, bumped the car in front of him. There was a little bit of damage to both vehicles. Well, okay, so yeah, it's a little scary thing that happens, right? And so as an adult, I was a little bit nervous for him. And knowing that I wasn't right there in the community, was in Madison and we live close to Milwaukee, get that panicked phone call. And so my first response was, okay, you just need to calm down, try to stop crying, you're gonna have to tell your story to the police officer, it's gonna be fine, they're not gonna take you away. So it's his first encounter, right, with police officers. And for me, it was minorly traumatic, but something that I pretty much got over relatively quickly. For him, however, that was a pretty traumatic experience. That happened 18 months ago. He still talks about it as if it was yesterday. And so it's how the individuals really take a look at what's happened in the context of what skills, resilience, coping mechanisms they have already developed in their lives. This tool is intended to be completed, the self-assessment tool, by a multiplicity of individuals in an organization. So all the way from maintenance staff to your staff level, mid-level managers, and those that are running the organization. And why is that? We, at a leader level, sometimes think that we communicate things very well, that all staff know where to go to find policies and procedures, that they know how to take care of themselves when they're experiencing vicarious trauma, and sometimes we don't communicate that very well. When in fact, most often, there's a huge gap in communication. Staff don't know what the resources are available to them. They may not know where to find a policy, particularly if we keep our risk management policies separate from our operational policies. And so needing to have staff complete this as well helps us give a sense of, okay, we've got a gap here. Leaders think this, staff think this. We need to change that perception in the middle. And, or maybe we do need to do some improvement. Maybe we don't have the kinds of resources we need for staff. All right. And then if any of you have attended any kind of trauma training, you'll know that the lens has been we're trying to shift the lens from asking the question, what's wrong with you, to asking what's happened to you. So that historical perspective of trauma. And at Children's, we are doing this in pockets of our organization. We tend to still use the medical model, which asks that very narrow question of why are you here today? What's bringing you to this clinic visit? In our community services programming, because we are better trauma focused in that work, we are better at asking this question, what has happened to you? What does your history look like? And not just your health history, but your trauma history. And then we're starting to, in our community services programming, ask the question of others who are caring not just for the child, but for the parents or for the foster parents. What does your trauma history look like? Because it's going to make a difference in terms of how they work with kids in their care. And just again, another reminder that it's the person's experience with the event and not the event itself that matters. Okay. All right, so we'll talk about two big buckets in this self-assessment. One is the establishing a safe physical environment. And then the second, which we'll spend a lot more time on, is establishing that supportive environment. And these are sort of the subcategories under that supportive environment. But let's talk about what does safety mean. And the model that Children's Hospital is using to assess safety looks at 4 different domain areas. So physical safety, which is that physical safety of as an individual, do I personally feel safe in this environment? Is my body safe in this environment? In terms of the physical plant or the physical surroundings, are there environmental safety things in place that help me to feel physically safe? Psychological safety. So do I work in an environment where I don't feel bullied? I don't feel as though I am unsafe, that my thoughts and feelings are, that they matter, that they're valued, even though that maybe the policies may not align with what I want to do, but at least am I valued as an individual? Social safety, and that is, do you feel safe in the group in which you're working? So is there that social safety? Are there people in my group that I can go to talk about when I'm having hard times? And not necessarily that I need to gripe, but how is it that I can talk about things that don't feel safe to me, that make me feel unsafe, and that I have that group, and that I don't feel like I'm being rejected, that I don't feel like I'm being gossiped about. And then there's the moral safety. And this gets at a little bit around whether the values of the individual match the values of the organization. So am I being asked to do things that are against my values? So, as an example, if an employee begins to work with Planned Parenthood and their personal value is that of perhaps a religious doctrine that doesn't support abortion, has that individual made a good choice in working for an organization where their values don't align with the organizational values? So physical safety. So this section in the document is not going to be totally inclusive of all of the physical environmental safety items that need to be in place. So keep in mind that what we selected were the bare minimum kinds of things. And we'll talk a little bit about this, but that section takes into account sort of lighting. Is the parking lot lighted? Is it the entrance well lighted, well lit? Are the hallways well lit? Locking of doors. So what we do at Children's in most of our buildings is we have what we call on-stage areas where clients and participants are able to not freely roam, but be present in. And we have off-stage areas. So off-stage areas include those areas that are staff only, that are either physician only, clinician only, or therapist only, and clients don't go into those areas. Do you have an ability if you don't have an ability to create those areas, then how do you ensure staff safety in terms of creating perhaps the sense of a physical barrier? So is there a hallway perhaps that from a paint color perspective, one is denoted as the client area, and by a different color it's by a staff area, and perhaps there's a sign there that says staff only beyond this point. So ways that you can create that physically safe environment for staff. Are you ensuring a welcoming and safe environment for your clients or your patients? At Children's, we tend to use really bright colors, right? So we work a lot with kids, but families as well. We want them to feel welcome in all of our facilities. In our therapeutic areas, however, we're not using as many bright colors. We're using things that feel a little more calm, if you will. So be thinking about the environment from that perspective. And then child-friendly or safe areas. I know that Waupaca County has done an awful lot of work, and I keep hearing about a mural I have yet to see. I need to go in their building and see it, but that they have a mural that is painted for kids, when kids are feeling somewhat disrupted internally, that they can go into that hallway, and it's an opportunity to say, count how many ladybugs you can find in this mural. Again, helps to kind of break that feeling of sense of unsafeness for the child and give them another focus. So in what ways do you have in your environment to create that's child-friendly and safe? All right. So the supportive environment. And this is where I think this line is going to cross a little bit with the presentation I think you're going to hear one of these months around self-care. So what you may hear from that individual may be parallel to what you're going to hear right now. But this includes aspects of psychological, moral, and social safety. And to the extent that we can create an environment that's open in terms of communication, but does not cross a line around breaking confidentiality, will help to be able to create a safe place for both your staff and your clients to be able to do their work. So at Children's, we are bound by HIPAA laws, and I don't know how far across outside of the medical system HIPAA applies. But we have a requirement where annually all staff, everybody in the institution needs to take a HIPAA training. And that's for two reasons. One, we need to ensure for all of our regulatory purposes that staff are versant with the HIPAA rules and laws. But secondly, this is a law that changes frequently, and so we need to make sure that they are well educated on the changes that have happened in the prior 12 months. We need to make sure that our clients and patients are also well educated about those changes. And so they won't be able to have that information unless we are proactive in ensuring that, that our staff are trained, that everything that we hand out is provided in a way that clients and patients can understand it, and we have it posted. And then we go one step further. We explain to them exactly what this means. And so it's this open communication where they understand what their role is as a client, they understand what staff's role is, they understand what each other's responsibilities are. And then if there's a need to have a private conversation, and I think about this in terms of what happens at our front desk, if you will, of every building that we have, sometimes there's confidential conversations that need to happen with the front desk staff. We have ensured that there are private spaces in most of our buildings for that conversation to occur, so that if there's anybody else in the waiting area, they're not hearing the business of that client that's walked in the door. Again, that's helping to create that safe environment, and it's helping for the client to feel a sense of being respected. Cultural competence. So this is a difficult one for us to measure outside of having provided training and making sure that people attend training. And I think that's a really good first start. However, there is a lot more to cultural competence and sensitivity and cultural appropriateness that I think is, as organizations, including Children's Hospital, that we need to be doing better at. And so, are they able to, our clients whose native language is not English, able to use their native language to get the services that they need? So how does an organization do that? Well, you could have an interpreter on site, and that can happen for many cultures where we have a number of people. I'm thinking about Hmong and Spanish, a number of folks here who are skilled at doing that interpretation. But then I think about, I don't know to the extent that you have Russian refugees here, but we have a pretty good cadre of them in Milwaukee. The number of interpreters who could come to the hospital and do interpretation for Russian-speaking individuals is pretty small. And the turnaround time in terms of needing to get somebody in that place can sometimes be up to 24 hours, and that's also unacceptable. So the stopgap method, right, is for us to have access to interpreters via the phone. Interpreter service on the phone, it is not ideal. And we don't certainly want to be using another family member to do interpretation. That's also not ideal. So to the extent that you can make interpretation a priority, face-to-face priority is incredibly helpful. And then obviously making sure that materials are in their native language is an important part of cultural competence. But then there's this other issue that sometimes crops up and can creep into this topic of moral safety. And so, staff, for the most part, I think do a nice job about being respectful of other individuals, but sometimes staff get into this conflict of what their moral comfort is in dealing with folks with whatever the issue is or whatever the topic is. And perhaps, it's around a political belief or a sexual orientation. Those tend to be the two hottest buttons. As an organization, how are we going to help that staff person feel safe? How are we going to help that client feel safe? Sometimes the best case is to remove that staff person from serving that client when there's that moral safety conflict and putting somebody in place who doesn't have that moral safety conflict. And unless we're aware of that, we can't do anything about it, and then it's going to create this disconnect between our clients and patients and our staff. And then obviously, I mentioned this a little bit around receiving training on cultural competency, but it's more than just training. It is about staff support. And if we think about, I'm not sure to the extent that what you all are doing is reflective supervision or reflective practice in your practice, but as you're doing, participating in supervision, those are terrific conversations to be having with your supervisor in a very reflective way about, I think I have this feeling when I encounter these kinds of situations in this cultural context. And being really open about that, and then strategizing with your supervisor about how to handle those conflicts that feel very uncomfortable. And then safety planning and crisis prevention plans. So there's sort of two components to this. And Children's is taking a little different stance on safety plans for staff. So let's first talk about the client-patient piece. So individual safety plans and crisis plans are developed for our community services side, our clients on our community service side, pretty regularly. And all goals for whatever the service delivery plan is are incorporated into those plans. What we attempt to do and need to do better is making sure that we include whatever the list of triggers is for that client or that client's caregivers. So, if they are triggered by walking into one of our buildings, we need to do something about that and perhaps not provide services in that venue to that client. And let's find an alternate place to do that. So if we find out that's a trigger, then we work to fix it. And then what is helpful to that client in order to be able to have them feel safe? And it's really having that very concrete conversation. I understand that something, either what happened right in this conversation or something before you walked in the door of the building is making you feel unsafe, and I'm seeing some behaviors that are a little bit concerning. Let's talk about that. What happened to you? And how can we help you feel safe in this situation? And how can we help you manage emotions? So what things make you feel better? What self-soothing techniques do you have that will make you feel better? That's not always a comfortable conversation and needs to be done in the context of a positive relationship that folks have with their clients. And again, not something we do extraordinarily well at Children's, and we're working on. So let's kind of look at the other population of staff. And I'm going to use an example of a group of employees that we have that work in a community violence prevention program called Project Ujima. And there are 11 staff and 1 leader, and in the last 10 days, and their job is to work with mostly youth where there have been some community violence that's happened, whether it's gunshot, knife, pretty significant fight, where they've ended up in children's ER. And our Ujima staff meet the parents and the kiddo in the ER, and then they walk with them through the healing process in the hospital and then back into the community and help them get reintegrated into their schools, make sure they're connected to counseling services, and really walk a path with them. The last week in Milwaukee, there have been 8 gunshots with 16, 17, and 18-year-olds, and one of them was fatal. And so this team of staff are pretty traumatized by the volume, right? So we'd never want to assume that what they're seeing weekly is okay, right? So seeing a kid who's been shot is not okay. And so we don't want to normalize that trauma for them. And now it's exacerbated by the fact that they've got this volume of traumas that they're experiencing. One of the pieces that we're putting into place is, we're not calling it a safety plan, we're calling it an emotional management tool. Same kind of thing. We know that in the moment you're having anxiety, you're feeling these feelings because of the work that you're experiencing. We want to help you have some really concrete 2, 3, 4 things that you can do when in the moment you start having those feelings, whether you're in the middle of working with a family or you are driving in your car to a home visit, whatever it is, what is it that you can do that will help bring those levels of anxiety and feelings down? So maybe it's in your head, you need to go to that happy place. Whatever the happy place is, beach, listening to the waves, whatever that image is. Or maybe it's, I feel so much better when I do this with my hair. It helps to calm me. Or maybe it's, I just really need to have a Diet Coke, because having that Diet Coke and feeling it go all the way down my throat really helps me feel better and feel grounded. Whatever that is. We have helped them put it on a little card that's gotten attached to their ID badge, the lanyard that they wear, so it is accessible whenever they need it. So that's a tool that we learned through the work that we're doing with the sanctuary model at Children's. And so we'll see in terms of staff report if it's made a difference for them. Okay. I mentioned this a little bit earlier, that in terms of creating a safe and supportive environment, that having that open and respectful communication with clients in particular, but also with staff, will help to create that environment of safety. So I think about one of our pilot departments who's, again, working with us on some of the trauma-informed care change. And it's a department where there's been a lot of infighting between the staff. And so in order to create this culture of safety, in order for them to be able to feel secure in talking about issues that are in the department, trying to keep things less about that interpersonal relationship where there's conflict and more about how can we improve the work that we're doing, we have instituted something that's called a community meeting. Every single morning, that team meets for 20 minutes. It's a really quick, there's 20 folks in the room. It's a very quick 3 questions, round robin, everybody asks the same question. Everybody's asked the same series of 3 questions. How are you feeling today? And you're not allowed to say good, you're not allowed to say fine. You have to dig deep and find, you can say frustrated, ecstatic, I'm curious, whatever the word is for you that day. There is no need to explain why you feel that way, just one word. Second question is, and what is your goal for today? Or what is your goal for this meeting? Or what is your goal in the next hour? So if a person has said to me, I'm feeling really overwhelmed, and I will say, what is your goal for the next hour? And can I check back with you in an hour to see how you're feeling? Helping to create that sense of, there's somebody here for you, I've got your back, and I care about you. So what is your goal? The third question is, and who is going to help you with that? So many times when you have staff and departments where there's a lot of infighting going on, they don't feel like they can rely on anybody to help them. And so this helps to call out the individuals in that room, or maybe outside of the room, who can help them with that particular goal. And it helps them to start giving us a sense, or giving the team a sense, as to who around them can help. It has, in this department, and it was awkward the first week or so of doing this, but now they miss it if they don't do it on a morning basis, an every morning basis. The team has started to gel. I'm not going to say things are perfect because they're not, but the team has started to gel. Few individuals who wouldn't speak to each other have now started interacting professionally with each other. It has made a world of difference, because now we're at the point of we're all human. We all have feelings. We all may come in the door with stuff that happened before we got to the office that day, and we carry it with us. And now we've had that opportunity to really get human about us. Using people-first language, right? So avoid that labeling language. You know, somebody's not an addict. Somebody is a person that has an addiction, because they can recover from an addiction. It is a disease. Somebody's not disabled. It's a person with disabilities. So it's sort of switching the way that we phrase and think about people with significant issues. And that emotions and staff for clients are heard and feel validated and affirmed. And we all know, those of us that supervise staff, that There will be encounters between staff or with a staff person that are going to rise to the level of an HR issue, right? So there's going to be something that might need to be done. But it doesn't mean that the feelings that the person has about that situation aren't valid. So they certainly are valid, and as a leader, if you can validate the feelings, but the behavior that just happened, or you yelling at your coworker, that's behavior that's just not okay, to take out your feelings in that way. So again, it helps to kind of smooth over to validate the feelings, and yet still address the HR issue that needs to be addressed. And listening is a skillful intervention, and sometimes some of us aren't good at listening. And we just need to close our mouth, let the talk happen for a certain amount of time, right? So moderate it, and then just say, okay, this is what I think I heard. So talk back. This is what I think I heard you say. Correct me if I'm wrong, because I want to make sure that I fully understand what you've just shared with me. And it's very validating to have somebody say to you, yeah, but you didn't get that part just right. So this is actually what I wanted to say. And I'm sorry, I like to say, I'm sorry I didn't hear you right. But this is what I wanted to say. This is what I think I heard you say. Okay. So this one, in terms of consistency and predictability, I like to liken this to kids who are on the developmental track. So kids from pretty much birth through middle childhood really thrive on consistency and predictability. They need to have a relatively consistent schedule. They need to, and their biology, they need to eat at certain times, and they'll usually tell you if they haven't. They need a good sleep schedule. They need a play schedule, but it doesn't need to be like, you have to do this at 3 o'clock. It's just, there needs to be some sort of a rhythm and a sense to their days. That's no different for adults, right? So for many of us, part of the reason that we are successful in the working world is that, well, we kind of have a schedule. We get up at 6 in the morning, maybe we walk on the treadmill, maybe that's the time where we get a cup of coffee and we have 20 minutes of quiet time before the whole house becomes chaos, and then we're at the office by 8 o'clock. And we go through our day, whatever that day looks like, and then at 5 o'clock, out the door, got to get home, dinner, baths for the kids, everybody in bed. So we have a schedule, and we have some sense of predictability in that schedule. Well, think about what happens when there's a disruption in our organization and what that means for our clients. So you have a staff person that takes a new role in the organization, or there's high turnover and you have people who are leaving consistently. That's traumatizing to the clients who maybe have developed a pretty secure relationship with that staff. How are we communicating that turnover, that change in who's going to be servicing that client? How do we communicate that with the client in a way that feels some sort of consistency and some sort of predictability? You're never going to be able to prevent that, the life from happening, right? So you're never going to be able to prevent that. However, it's how you respond to it and the kinds of words that you use and the way that clients feel about that feels supportive and safe. There's something else I want to say about this. And then for staff, so sometimes, and I know in the human services world, there can be some pretty big shakeups in departments, and sometimes you just can't communicate the why of why somebody has been let go. But you need to be able to be sensitive to the fact that it's disrupting the team and they feel a sense of loss, and to validate that it's okay to feel a sense of loss, and here's our plan for moving forward. This is what we're going to do in order to ensure that you feel safe and secure in your job and your role for the time that you're with us, and here's our plan for bringing in a substitute staff. And it's important that staff have an opportunity to grieve those losses. Now, there needs to be a time and a place for that to happen, but we, as leaders, tend to create these vacuums where rumors and gossip just start to flourish, and that's not good for any team. So making sure that we create the time and place to have the conversations that need to happen around what is the changes that are occurring in an organization. All right, so I have 2 quotes for you. This one is a famous Maya Angelou quote, and it truly is, that people will always remember how you made them feel. They may not remember the event, they may not remember exactly what you said, but they're going to remember exactly how you made them feel. And so I think for staff to understand that they have the ability to have their clients feel valued and supported and safe, that they can control that by how they say things. And sometimes it's not the what you say, it is the how you say. Same for staff. As leaders or with your coworkers and colleagues, you have an impact in the way that you say things, the way that you provide them support when something bad has happened with the team, or maybe there's something that's happened outside in their personal life. And they just need to know that, hey, I've got your back, and how can I help you? What can I do to jump in to support you? The Project Ujima team that I was talking about earlier, we've had leaders from all over the organization contact the team to say, we understand these are tough times right now. Please reach out and let us know how we can support you. And we understand your leaders are doing these several things for you, but let us know what more you need. Because then you feel valued, you feel a valued part of the organization. And then the last quote that I don't have on the slide that I'm going to leave with you, and I saw this morning, and this relates, in my mind, to the trauma experience. The greater your storm, the brighter your rainbow. The greater the trauma that some of us experience, and sometimes when we're in the middle of that trauma, or with our clients, we're in the middle of the trauma, the brighter the rainbow may be on the other side, and we need to hold hope, right? So we need to hold hope for them, we need to hold hope for us, because at some point things will start to turn around. We just need to hold it together for them. Thank you for the invitation today. Go forth and enjoy the beautiful day today.